Hi everyone. Today we are going to discuss about the back pain. What is the reason for the back pain and butt and thigh and leg pain, cough squeezing and foot paresthesia, numbness, not able to walk. While walking, chapels is slipping out of the foot. So what is the reason for that? Collectively we can call as a back pain and sciatica. So what is the reason for the sciatica, how it will present and how we will diagnose the sciatica and what is the treatment remedy for that, what is the permanent solution for that, what is the preventive measures to avoid the back pain and sciatica. Globally, more than 100 million people are affected by the back pain, disc prolapse, leg pain and sciatica problem. In that, very commonly it is a disc degeneration, which is much more common in India because of the chronic bending activities, heavy manual labor workers, and in females they are working with bending back. Frequently they are cleaning the floors and sitting in cross legs. Sitting is cross legs is good. But as concerned as a spine, it is a major issue because of the chronic bending which leads to the wear and tear in the back disc, which produces the disc prolapse and ultimately the back pain and leg pain. In Indian scenario, another reason for the disc prolapse is the main common thing is recently in the sedentary lifestyle and the obesity. The obesity, it may be because of lack of physical activities and poor diet and for genetic reasons. So the obesity plays a major role in the disc prolapse, and another reason is the heavy manual bending work. So there are 4 stages in the disc prolapse. Stage 1 is the disc bulge and stage 2 is the disc prolapse, which you find in the MRI. The MRI report came as a disc bulge in the L4, L5 and L5S1, and stage 2 will be the disc prolapse, and stage 3 the extrusion of the disc, and stage 4 is the sequestration, which is the final stage and which ultimately affects the back and the leg and foot. So apart from the commonest obesity and sedentary lifestyle and bending activities, the diabetes plays a major role in the cause for the disc prolapse by reducing the viscous elasticity in the disc. If you see the disc anatomy, the disc is the suspension for the back for bending, twisting and turning while taking lifting weight and while sitting. So the bending of the spine, which is only possible because in between the bones there is a flexible portion and the suspensory portion is the disc, which is insidely it is a jelly which is covered and strengthened outer by the annulus fibrosus, which is a very thick wall structure. Anything happens, anything pressure increases, damages the annulus fibrosus, which ultimately leaks out the nucleus pulposus, which is the jelly and which is the suspension, which is the mainly responsible for the bending activity of the spine. So the disc is mainly damaged, the annulus fibrosus damaged by the obesity and bending activities and the sedentary lifestyle. While you are sleeping, the normal pressure inside the disc is 25 kg, while standing it is 100. Bending from the standing position, it is doubled to 200. While sitting in the chair and bending, you are taking some weight in the floor, that is almost tripled. See, normally in the floor, when you're sleeping in the supine position, flat position, it is 25, which is 100 while standing. While bending from the standing position, it is double to 200. While bending from the sitting position, which is usually happens while in the work, the software work or in the chair work positions, they will bend from sitting position, which is almost 300. So that is the reason for the intra-disc pressure is increasing, that is damaging the annulus fibrosus, which leads to the stage 1, stage 2, stage 3, stage 4 disc prolapse. So symptoms of the disc prolapse, it's based on the stages. See, we already discussed about the stage 1, stage 2, stage 3 and stage 4. Stage 1 is just a bulge, lumbar disc bulge, which evident in the MRI. And second stage is the lumbar disc torn and the nucleus pulposus getting out, that is called disc prolapse. So these 2 stages are very common. It accounts for the 90% of the lumbar disc diseases. The rest of the 10% in stage 3 and stage 4. The symptoms, how they will present. We already told the back pain and butt pain, thigh pain, leg pain and night pain in the cough and not able to tolerate the pain, repeated cough pulling and foot paresthesia while walking and burning foot during the night, and while walking the chapel is slip out of the foot. These are the symptoms of the disc prolapse. Much very rarely, less than 1% of the peoples will affected more, and they will have loss of urine and motion. The bladder and bowel control will be lost. They can't able to walk. We will think because of the old age, because of the knee pain, they are not able to walk. It's not like that. Suppose the patient is having knee pain in the age group, in the older age group, they can able to walk with some support. But in spine disc problems, in end stages of stage 4 diseases, not having any sensation below the hip, and they can't able to straighten their legs, they straighten their knees, they can't able to walk with the loss of urine and motion control. That is called Cauda-Equina syndrome, which is very rare, and it's the last presentation of the disc prolapse. We should avoid that. That's why we are presenting these details about the disc prolapse. So our videos is focused mainly on to restrict and prevent the patients with a disc prolapse should not go for a Cauda-Equina syndrome because of its end disease. It's severely disabling. It's a surgical emergency. These are the presentations of the lumbar disc prolapse and what to do if you have the back pain and not able to sleep, and we have leg pain, not able to walk, which was not able to controlled by ourselves with a simple painkiller gel and rest. So immediately go to our orthopedic doctor. They will examine you in the back because your problem, you will start the pain in the back, and it is radiating up to the leg. Neurological examination is like a straight leg raising test and do some sensation test and motor test. So these tests, after this test, they will conclude where is your problem and how much it is. So they will confirm with the X-rays and MRI. And X-rays ultimately which shows there is straightening of the back spine, which is not a normal. So it indicates that the tight muscle spasm. We will again confirm with MRI whether the disc is already, we discussed about the stage 1 with bulge, stage 2 prolapse, stage 3 extrusion, stage 4 is a sequestration. So in that we will finalize that. See, here there is a stage 1, here it is more bulge, it is prolapse stage 2, here the disc is almost outside and which is compressing the spinal cord, which is behind the disc, so which produces the leg pain and foot numbness. So this is stage 3 or stage 4, which will be differentiated by different angles of MRI, like this is a side view and we'll have a front view, cross-section view. There are 3 views in the MRI. In 3 views, we will finalize it is stage 4 or stage 3. More than 90% it is stage 1 and stage 2. Around 10% of the people will have 3, 4. Very rarely, less than 1% of the people will have Cauda-Equina syndrome. Most common disc prolapse in the stage 1, stage 2, which ultimately the medical management with a simple, if you have back pain with the leg pain, consult a doctor, confirm with the X-rays and MRIs and clinical examination. After that, you will find whether you are in the stage 1 or stage 2. If you are in stage 1, stage 2, simple medical management is like rest, wearing the back pain belt and do physiotherapy for the back pain and leg pain with IFT, laser and traction like that, along with medications to relieve the pain and reduce the nerve edema, which is the reason for the sciatica and foot numbness. You can take some medicines to reduce the neuropathic pain. Along with that, you can take, if pain is much more severe, you can take painkiller injection based on the doctor's advice. If you taken this, you will continue for 1 month. The pain is settling down, it's okay. Suppose if it's not settling down, still you have to consult a doctor for review. They will consider much more next level of management. Up to 3 months, your pain is not settling, you have to go for epidural steroid injection. Epidural steroid injection to relieve your back pain and leg pain. This, most of them will ask whether the injection, how much it will be effective. Definitely it will be effective. You are in the stage 1, stage 2. There is no surgery needed for that in the situation. So you tried medical management, you tried physical therapy, lifestyle modification like walking and fitness and exercises, medicines, belt and physiotherapy. In spite of that, pain was not reduced. So in that situation, you have to go for epidural steroid injection. Suppose if it is the stage 3 and stage 4, the pain is more severe, not able to tolerate and not able to control by medical management, they have to go for surgical management. For disc prolapse, stage 3 and stage 4, which is having back pain and leg pain not able to controllable by a medical management, all these measures, we will consider endoscopic, laparoscopic and arthroscopic surgery. There is a keyhole surgery for the spine also, which you can admit today and discharge tomorrow without any pain. You can do your daily activities immediately after surgery. Within a month, you can return to your normal activities. For heavy weightlifting activities like bending activities, you can continue after 3 months of surgery. This is very small surgery which will be rarely indicated, especially where the pain is not controlled with the medical management. And very rare situations, if you have disc prolapse at multiple level, more severe bilateral, both sides, right and left side, and as I already told, Third syndrome, like that, severe pain, both legs, burning foot syndrome, both foots are burning. So in that situation, very complex situation, we cannot opt endoscopic surgery, spine surgery. In that situation, we can have an open surgery with a minimally invasive transforaminal interbody fusion. It's a very beautiful surgery which will put screws and will remove the damaged disc, which will not have a future back pain and leg pain. After surgery, immediately you will be pain free and you will sleep immediately after surgery without any leg pain. Within a month, you will recover better. You can return to your activities. So this transforaminal open surgery will be the last resort, only limited to multiple level disc prolapse, both sides, already operated disc, already surgery done, it was recurring back after a few many years. So in that situation only we will prefer open surgery. So more than 90%, stage 1, stage 2, medical management, multi-modality of management like physical therapy, belt, medications, weight reduction, proper lifting technique, lifestyle modification, walking, active physical lifestyle along with medications and physiotherapy. Suppose if it is not improves, we'll put epidural injection treatment. Still, it is not useful. Or in stage 3 and stage 4, the surgery started from the endoscopic and with using microscope and open surgery. So, surgical methods only accounts for the 10% of your back pain and leg pain issue, which will have very good result whether the pain is not resolved by any modality of medical management. That is a last resort, but it is a very beautiful, a very good result, a very good prognosis for the surgical based on the endoscopy, micro-lumbar discectomy or open surgery. That is based on the MRI findings and previous history of spine surgeries, and how much you will have symptoms, whether you have unilateral symptoms or bilateral symptoms, already operated one. So it is based on that. But anyway, I think this video enlightened the what is the reason for the back pain and how it presents, what to do and what is the remedy. More than 90% settled with medical management, only 10% of the people will need surgery. In that, it starts from the endoscopic up to the open surgery, which will have very good results in concern to the spine surgery. People are fear of spine surgery, but don't fear about the spine surgery, because in olden days, the open surgery, which leads chronic days of 6 months of immobilization like that. So because it was very open and we opened the bone, and a lot of things, major invasive surgery at the time of invention. Nowadays, because of the technological development, the surgical procedures are very, very simple and very promising results to the patient. So don't try the medical management. If not improves, problem is more, definitely don't hesitate to go for a surgery, because it will give you a better future without back pain and leg pain. You can continue your better life, quality of life. If any doubts, kindly contact me. Thank you.